it's not great, right? But anyway, well, let's get started. It's 11:45. So again, thanks everybody for coming. Just wanted to do a few announcements before we get on. We have our sponsor today is PSE. So thank you so much to PSE for sponsoring. And Julian Lowe, who is the Local Government Affairs and Public Policy Manager, is going to be giving us a few just kind of updates of what's happening at PSE, and I'll kind of hand it over to him in a little bit. But first of all, I wanted to share with you, let me get to my next screen. It's going to be hard to see a little bit, but just want to make sure you guys know of some things that are taking place, in the world, the helping small businesses during COVID. And one thing that got sent out via email yesterday was there's a new grant now available from King County. This is CARES Act dollars that the county has wants to provide for small businesses. 50, I believe the eligibility is you have to have 50 employees or less. It's something, there's a link on our, we did a Facebook post. We also did a link through the email that it opened on Monday and it closes Monday. So you have like a week to fill out, and if you're interested in applying for that grant. Of course, the requirements are that it has to be a COVID related expense. And even if you had a grant from some other organization or another one from King County from before, you can still apply. It's just you can't, they ask, if you were to be audited, you have to make sure that you haven't used the expenses for this, or use the dollars for the same expense. So basically they don't want you to double dip is what they're saying. But they're giving awards out in $5,000, $7,500, or $10,000. So if you're interested in that, go and check out that website. The city of Maple Valley is also has their PPP reimbursement program, and I know Laura's on the phone here or on the call. But basically, what that is, if your business is within the city limits, Maple Valley city limits, and you had an expense for PPE, say sneeze guards, hand sanitizer, any of those things, you can submit a reimbursement form and be reimbursed up to $1,000. And I think that's correct, right, Laura? I'm going to kind of put you on the spot. Just if you wanted to say a few things about it, if you're there. Okay, maybe she's
muted.
So if you have any questions, let us know. There's links on the city's website under the economic development department area. We also have, we've been, throughout the last couple months, we've received PPE supplies from King County through a program they had where they purchased cloth masks, disposable masks, and hand sanitizer. And so we've been delivering those to our businesses throughout the community for those that want them. We're pretty much out of most everything except for cloth masks. So if you, they look like this. They're like the white ones. I call them the diaper masks because they're like made out of, I think, Hanes underwear material. But anyway, if you guys need any of them, let us know. We have quite a few left that we can give to you. We also have our next luncheon, which is October, I think, sorry, I should have this memorized. October 21st is our October luncheon, and that's going to be our candidate forum for the 5th district, legislative district. So we have Senator Mullet and Ingrid Anderson and Moninsky and Ramos. We'll be doing a candidate forum with those folks. It'll be virtual, obviously, and you're welcome to join with that. And then we'll be announcing our virtual auction. We weren't able to have our gala this year due to COVID, so we've moved to an online format for the auction part, and we're going to run that October 26th through the 30th. You'll be getting more information hopefully by the end of the week with kind of the theme. We're just kind of working on that and just putting the finishing touches on it. So if you have anything that you want to submit to our auction, let us know. You'll probably be hearing from us as well. And we look forward to bringing that. We want to really sort of showcase our businesses in the community, and so this way, kind of like as Sean mentioned earlier, you're going to have a broader reach because the folks that normally bid on the items are the folks that are at the event. But this way we can kind of get the word out to our public of, hey, these are the great businesses that make up Maple Valley, and really it's important to kind of support those folks and keep things going. So, and then last but not least, we have, just for those of you that are not familiar with who our board of directors are for this coming year, this is, if you can see it, we have Griffin. She's on the line. I know she talked in July about she took over the presidency in July, and then Brett Pavnik is our past president, and then Becky Sheets, who's on the call today. She is becoming, or she has become our president-elect. So she will be the new president starting next July. And we have Lucia, who is vice president, Gary Taylor, who's our treasurer, and then our directors are Brad Johnson, Lori Cloud. So Brad's from Johnson Home and Garden, Lori's from School District, Amanda Gross is from Edward Jones, and then Gary Thompson, who's a business owner on Merit Marketing. So just for those folks, just for those that wanted to know, let me see if I can figure this out. Okay, now I'm going to go ahead and if anybody has any questions. I know actually one other thing, I just want to say, I think Emily, you're one of our newest members. So do you want to just say a few little words, say hi, and just introduce yourself and say who you are and what your business is?
Sure. Yeah, so I'm Emily Pierre. I grew up here, went to Tahoma High School, and have just moved back after being in St. Louis for 5 years. I'm with Edward Jones. I'm a financial advisor. I'm Denny's daughter, and I'm working out of his office. So I am excited to be back and reconnect with the community. Even though it's a little bit of a weird time to do that, but excited to meet you all and happy to be here today.
Great, thank you so much. All right, I'm going to go ahead and Julian, you're on tap. Thank you again for being our sponsor, and tell us what's happening over at PSE.
Great. Well, good morning, everyone. Julian Lowe, Local Government Affairs Manager for Puget Sound Energy, and we are again pleased to sponsor today's luncheon. You know, as a provider of essential service, you know, we've been working really hard over the last several months to be here for our customers, our community, and our employees as coronavirus impacts the region. And so we've taken a number of steps in a variety of ways to support the community. For instance, we haven't disconnected customers for non-payment during this time. We've been given the ability to waive late fees. And then we also have multiple bill payment assistance programs available to income qualified customers who have either had work reduced or have lost their job or had someone in their household lose work as a result of the pandemic. And so this is our Crisis Affected Customer Assistance Program, KCAP as it's known. And to date, we've distributed $7 million throughout our service territory out of an available pool of $11 million. And I wanted to call out an important deadline. So if you or know of someone who's been certainly impacted in terms of their livelihoods as a result of the pandemic, please visit our website. We are accepting applications for that program through September 30th. We've also been working with our customers on payment plans and choosing a new bill date. That provision is important because that applies not just to our residential customers, but to our small and medium-sized business customers as well. So please do give our Customer Assistance Center a call if that's a resource that you think you need. What I've always appreciated about the Chamber is that it's organizations like this that really help to bring people together. And, it's really important now more than ever that we look out for each other. And so to that end, the PSE Foundation has started a grant program to provide funding for charitable organizations that, have either helped to provide access to shelter, food, and other critical PPE supplies, or if they're in need of funding to keep their charities' doors open in order to provide those services to community members, we would certainly encourage you to apply for one of our foundation grants. I wanted to, again, call out another critical deadline. We are accepting applications through October 1st, with awards being distributed in December, and those award amounts will range from $1,000 to $20,000. And then finally, as we are all, coming back to school here, some of us with children in schools, Puget Sound Energy has recognized the great digital divide that's out there And so together with Microsoft and the Seahawks, philanthropic organizations, other state agencies, and representatives of indigenous communities, we participated by contributing to the Digital Equity Initiative. That's part of the All in Washington relief effort. And so this will provide critical resources to close the digital divide and support remote learning for students across the state as schools return to session. And so that's just a high-level overview of what we've been doing to assist customers. Certainly we've been, supporting food banks, the Washington Food Fund, and other efforts to provide food security for our neighbors. And certainly we, again, wanted to call out that grant opportunity, and then also the opportunity as it related to bill payment assistance. I also wanted to thank folks in the Maple Valley, Black Diamond, Ravensdale area for their patience last week as we responded to last week's windstorm. I think that it's always a great opportunity as a safety moment, but as we're heading into our winter and fall months here to, remind everyone to be prepared. And so one that certainly involves keeping track of the weather that'll be around, charging your devices, and then also, when you got a little free time right now, download the My PSE app to your smartphone or other device. That way you can certainly track outages, ask to be notified about outages, and then also contact our customer care center. I see Laura on the Zoom meeting today. Always wanted to call out our great working relationship with the city. So I'm going to go ahead and make sure that Erica has the links to some of the information I shared today. And I think during this time, it's just now more important than ever that residents, businesses, and local jurisdictions are all being there for each other. So thank you again for this opportunity to sponsor today's lunch.
Thanks, Julian. Does anybody have any questions for Julian by chance? If that's okay. Sorry, I'm gonna go back here. Great. Just wanted to let you know and welcome Josh, our speaker, is on the line here. And before I introduce him, I just kind of wanted to lay the groundwork of how this all came about with the topic of mental health in the workplace. So back, probably last year around this time, I just was like, we need to have some sort of topic about, people's mental health in the workplace, because, there's a lot of stresses that happen, and, business owners that are kind of single shop, how do they handle all the pressures that they have to go through, along with those that have employees and handling their mental health. And so, I just thought it'd be a good topic to have. And so I got connected. My husband works for Providence, and so I got connected with him, and we ended up working with someone to get scheduled for this back in March. And so we were supposed to have this topic in March, but of course with coronavirus happening, and that March luncheon got canceled. And so we have now rescheduled it for September. And I would like to introduce our speaker, Josh Cutler. Wave, Josh, so people can see you. I'm going to read his bio, and then I'm going to let him take it away. And hopefully you will take some information away with you that can help you as you kind of move forward through this time. So Josh is a psychotherapist, a licensed clinical social worker, an innovator in the mental health field, and he leads a team of behavioral health specialists providing evidence-based interventions to providers and caregivers working in the hospitals and clinics of Providence, our nation's third largest health system. He regularly facilitates workshops on wellness and burnout for professionals. His experience spans transforming organizations in senior management roles, actively influencing public policy at the state and national level, and working in a range of clinical settings with individuals and families to achieve mental wellness. His current focus is on utilizing cutting-edge technology to increase access to empirically supported behavioral health treatments. So with that, Josh, it's all yours. Welcome.
Thanks, Erica. Thanks everybody for having me virtually. I'm sorry that we can't all be in person at this point for a variety of reasons. And Erica, I'm gonna have to get some Zoom tips from you later. I've never done
You like
that
my Prezi
picture in
stuff.
picture. That's really cool. Yeah.
Yeah, no, I'll help you if you need
Um,
to. Give me a call.
okay, so I've got some slides here. Oh, is it possible for you to enable screen sharing for me? It's not letting me do that. Oh, there. Um, okay.
Oh, good.
So I'm gonna just leave it up there so I can still see all of you. All right, so I didn't realize I sent her that long bio. Thank you for that introduction. um, and
No, that's
so,
okay.
so this is me. Those letters after my name mean I have a lot of student loans, and that that I listen to people's problems all day, both as a manager and as a therapist. So that's what that's about. And I work in a very large health system. I'm going to talk a little bit about Providence and our footprint, just so you have an idea. My background is actually working for smaller nonprofits. I thought that I had worked for some big organizations before, but this is kind of the most corporate organization I've ever worked for, even though it's a nonprofit. So just a little bit about Providence. We're actually the combination of a number of brands, a number of health systems that you may have heard of. So, of course, Providence, Swedish is in this area. My daughter was born at Swedish. It's kind of my backyard hospital. PacMed here. And then we've had some mergers in the last couple of years, like St. Joseph Health down in California, Covenant over in Texas. And then I'm part of the telehealth group, which we were doing a lot of things quietly until right before coronavirus, and then suddenly we've been in high demand. So I'll talk a little bit about that. But so Providence, we have 51 hospitals, over 1,000 clinics. We have 5 million patients. And in my work, I take care of our employees. So I run a mental health service for our 120,000 caregivers, which is what we call our employees. And that includes our 38,000 nurses and 25,000 physicians. And so this is basically like a $25 billion operation. So it's been really interesting for me, coming from being a director and manager in much smaller social service organizations, to kind of see how a big organization operates. And I can tell you, being on the inside, it's not always as smooth as it looks on the outside. But I'm very interested in what's also happening in your small businesses. So hoping we can have this be a conversation where people can participate a little bit, if people can participate in the chat, or it's not a huge group, and I've got you all up on screen. So if people want to go off mute, that would be fine too. Happy to answer any questions that you have. So these days, I think are talking about mental health a lot more than we used to. I think especially the younger generations, it's becoming a lot less stigma around it, just having these conversations. But in the workplace specifically, just wanted to call out that 200 million work days are lost to depression each year, and the annual cost to the economy in the U.S. is 201 billion. And I should say that that's not just the absenteeism and work days lost; that's a presenteeism. So I certainly have had days where I've showed up not being very productive, but I've had employees that have worked for me that I've find myself struggling with, that their low productivity maybe being related to more than just laziness. Maybe there's something more going on. And nearly 60% of people with a mental health condition go untreated. And a part of that is that our mental health system is really hard to navigate. And that's something I'm really passionate about. And we're doing some really innovative things at Providence that I'll share. But and telehealth is a great way to democratize mental health treatment, because it takes away some of the geographical barriers. And also, people are sometimes more comfortable being in their own home, looking at their smartphone or their laptop, rather than going into someone else's office. That's been my experience as a provider. So as far as the impact of mental health, the WHO estimates that depression and anxiety cost the global economy around $1 trillion each year in lost productivity. And also we found that workplaces that promote mental health and support people with mental disorders are more likely to reduce absenteeism, increase productivity, and benefit from associated economic gains. And I should say not just mental disorders. Sometimes we just kind of carve out like somebody has a mental illness and that's far from what most normal people might have going on. But it really is a spectrum, and modern stress and burnout are real phenomenon that everybody experiences, and it's a crisis in our health system with our nurses and our physicians especially. We have a very high rate of physician suicide nationally, and those aren't folks that you know typically think of as being people that have a lot of mental health problems, but some of the conditions that are under cause a really high amount of stress. And so working as much as we can upstream before people get to the need where they're having a breakdown and need maybe to see a psychiatrist, but maybe some counseling or some other self-help skills might be more helpful. So some key points I just wanted to make sure and hit. One is that your laptop might break your teeth if you're biting too hard. And I know there's certainly moments that I have been tempted to do that. And I think my toddler actually has chewed on my laptop, and now she's just left it covered with Sesame Street stickers. But poor mental health and stress can negatively affect your employees' productivity, engagement, and functioning. And employers can promote wellness and increase access to tools that may help. And we have a big wellness program at Providence. We have a whole team that like finds these benefits and shares them. And I know that might not be something you can do, have a structured, wellness team in a small business, but there are things you can do just as a leader of your team to promote wellness and promote some of those things and really have a culture of mental health. And communities also play an important role in promoting overall wellness and mental health of our members. I think a lot of us right now during COVID have really been aware of how much we took for granted in our communities. I certainly have, even just like going into the office and the people I'd see and just the brief conversations I'd have, even the person at the front desk that I don't usually interact with in meetings or anything. And now, I have certain people I talk with in Zoom meetings all the time, but I think the broader part of my day-to-day community, and then certainly friendships have been impacted, and just not being able to get together with people in person. So just being reminded that no one is an island, and our bodies and our nervous systems are wired for being connected. In prehistoric times, we survived by sticking together, and so when we're isolated, we actually go into can go into a more anxious state. It's more of a fight or flight state because, again, prehistorically, if you were on your own, you were a lot more likely to be eaten by a bear than the people that were in a big group. And so making sure to give your body what it needs, food and exercise and sleep, and also time being connected with other people. So as far as like red flags to watch for with your employees, but we're all humans, so checking in with yourself as well if things might be coming up. Changes in sleep or appetite, loss of interest in activities that they used to enjoy, emotional sensitivity, withdrawing from social contact, absenteeism or increased difficulty presenting to work on time, and signs of substance abuse are important pieces. And I would say upstream from this, what I would encourage is getting to know the folks that you work with, because that's how you're going to start to notice if something's off, and taking the time to just have, when the business is done or even before you get into it, just take a few minutes to just check in. How are you doing? Get to know people a little bit. It can be on a professional level, but I think asking about people's families, especially during this time, I think in the past we all had different stresses going on, and maybe there's a stigma about keeping up a certain presentation of how our life is going, but that has been sort of taken away in the fact that we are all in the midst of this crisis, this pandemic and the smoke, and I think we can all, my kids are in school, and suddenly all the people that I work with that have kids, where we all had our own situation where we were managing, now we're all like, what are you doing? Oh my gosh, like how is Zoom school working? And so just being able to connect on that human level is so important. And so again, when these things are things that might come up, if someone just mentions like they're not sleeping very well, it might just be a one-off comment, but it might be worth checking in with them next time you see them. Like, oh, well, last time you mentioned you weren't sleeping very well. That's a big sign of a lot of mental health conditions. And that's often when people deteriorate. Sleep is the first thing to go. And substance abuse too. I mean, that can be noticing changes in behavior, but it could also be that people, aren't showing up to work hungover, but they just don't have as much energy, and partly it's because they're drinking a bottle of wine every night to unwind, and yeah, they're not showing up to work drunk, but it's probably not, contributing to their overall well-being and them bringing their best selves to work. So maybe there's some other things they can bring. And withdrawal, I think, is also a big one. Isolation, that's some people's way of coping. It's certainly a way that I do. When I notice my sense of humor and my interest in engaging with others kind of going away, that's definitely a sign to me of like, okay, I need to reach out and get connected to folks. And here's the next slide. So specifically around mental health in the workplace, specifically, my world is healthcare these days. Health and safety are big. We actually experience, you'd be amazed how often our staff are assaulted at work by patients. And so that's something we're often working with, or family members that can get really irate about certain things. It's just a very sensitive time. But if people don't feel safe, I mean, that Maslow's hierarchy of needs, that's really essential. That can not just be physically safe. I mean, if they're working on a construction site, there's a piece of that, or working with the chemicals, but also emotionally safe. That is my job on the edge of being lost, or am I being asked to do things that feel like they're outside of my skills, and I might fail and get canned because people are getting canned right and left around here. And so being paying attention to some of those things, and communication and management. And again, I think, and this is one thing that I think you have hands down an advantage over as small businesses, is that you can know the names and have personal conversations with all of your folks, I would hope. And to be able to have those moments where you're getting to know people, so that then when you need to have hard conversations, they trust that it's coming from a good place, that it's been thought through, and sometimes communicating things different ways in writing and verbally, because people hear things differently, and can even say, well, I didn't understand that, and even though you've said it a few different ways, so that would be important. And also, I mean, depending on the line of work that you're in, there may be just rigid work hours. Certain things have to be done certain times, but that's something that is definitely, especially during this work at home time, personally for me, having some flexibility and some, even a work from home policy where basically I just have a lot to do, and as long as I get it all done, that's the priority, rather than really strict time. And then also keeping in mind that work environment and safety, and also jobs that are not a good fit for employees' strengths. There's a good book here. This is called the Strengths Finder. I don't know if people have ever done this, but I did this recently with my team, and actually our whole telehealth group, and I was excited to find that most of the areas I was in were strategic. And for a second I thought, am I in the wrong line of work? Should I be over in the strategy group? But then I was talking with a colleague, and they were like, no, that actually qualifies you really well to be a social worker. I'm always thinking strategically about how to intervene and address the situations I'm asked to work in. So that can be really important, just a mismatch in skills skills. And in a small business, often people are asked to wear a lot of hats. I totally get that. And I'm at a point in my career right now where they just would never ask me to like be a project manager or do something technical, where in past jobs I would do a lot of that kind of stuff that I really have no business doing. But I know that you all are, you know, probably hiring people that are have multiple skill sets. So, but just making sure that you aren't just retraining and retraining when it's just not something that's going to be a good fit for them. And then also just paying attention to high workloads. I mean, times things can go up and down. Certainly, I think it's the unrelenting piece that if it never comes to an end, or people feel like there's no celebration of the wins and it's just like work and work and work, that can certainly cause morale to be broken down. So as far as promoting healthy workplace, so doing whatever you can to reduce or mitigate some of the risk factors when possible, implementing health and safety policies, having staff identify the positive aspects of their work and building on those whenever possible. I'm doing a project right now with the Institute for Healthcare Improvement called Joy in Work, and it's really process improvement with kind of a cuddly sounding name, but rather than just it being about quality and good patient experience, it's also about good provider experience. And I think we would all want a doctor that or a nurse that's looking forward to coming to work and likes being there. And so how do we create a space that, you know, really fosters that sense of engagement? And so so taking the time to just check in with people, like, hey, I know parts of this are hard. Maybe I'm even talking to you a lot about the parts that aren't going well, but what is going well and how can we build on that? Because that probably gives them more energy and encourages them to come to work, even if it's a small part of their job. I think creating a culture of openness, sharing concerns and feedback without negative repercussions is really important. I don't know if anybody's read the book Servant Leadership or looked at that approach, but that's one that I really follow with my team, that I'm there as a support, and sometimes I have to have hard conversations about this is the way certainly things are, and treating people like adults and giving them the information that they need to be able to do their jobs, but really showing up as a support. And so that may also include, as a leader, stepping out sometimes and creating opportunities for people just to connect with their peers. And with my team, I recently set aside time for them to, because they're working virtually, block their schedules to just meet with a peer once a week, because I think that they need that. And I was hoping to have more time to meet as a team, and we couldn't make it work. And then it was like, well, we could block time to meet as peers, when in the past maybe we would have had lunch together, or we would have seen each other between things. There's just a lot of collaboration that happened when we were in the office if you're working virtually. And then recognizing and rewarding employees regularly, that stuff goes a long way. And so even just the little things, making sure to just take that time to recognize good work, and making sure also that certain people whose work may be happening more quietly are also being noticed. And then also having mentors or colleagues who can provide some support. I think it's important to have mentor opportunities who aren't your administrative supervisor. If that's an opportunity, I'd hope each of you have that. And also, if there is opportunities for that with your teams, encouraging people to connect with each other with more senior people if they're looking to develop their careers. So as far as one-on-one conversations, I would say if someone discloses a difficult situation, practicing active listening. So sometimes we can listen to respond. That's not this. This is making eye contact, slowing down. I think I find a good way to do that is just get in touch with my breath, really pay attention to looking at their face, what's going on with them, or listening to them, their voice. It can be so easy to be distracted. If you're on the phone or you're on your computer, and some of us, I have multiple screens open right now. It's pretty easy to get distracted, and I think people can tell, they can feel that, especially if it's one thing if you're just in a meeting and and it's not as intensive a conversation. But if it's one of these times to lean in, I really encourage you to take that time to just fully give them your presence, and asking non-judgmental, just kind of open-ended questions. And bring curiosity to it. Sometimes it can be really easy to have our mind made up about what's going on with somebody, and that they just need to do what we tell them, and and that isn't always effective. And actually, it may be that the way you get them to do that is you take a little while to listen, and then you guide them to what you know is probably the best. And that's in my approach as a therapist. We call that motivational interviewing. That that came out of the addiction world, where rather than telling someone they have to change and they have to quit drinking, you're helping them to come to that realization on their own and actually argue for change themselves. And so but the only way to do that is to create that safe space. And again, you don't have to offer a solution. Sometimes we can feel like people are coming to us looking for answers, and we need to get right back to them with something. But it could be that you just open up to more of the possibilities, and then work through some of the options, and then just make a commitment to come back to that. And again, if the issue requires professional attention, if someone's in a mental health crisis, substance abuse, if you're concerned that somebody might be suicidal, I encourage you to ask. It's not going to put that idea in their head. If it is already there, it's already there. If it's not, they're going to say no. That's not something I'm thinking about doing. It might be a little awkward, but it's a lot less awkward than visiting them at the hospital, or going to their funeral. If you're really that concerned that someone might hurt themselves. And I'll talk a little bit more about some of the resources in some of the later slides, because there are certainly resources available. And this slide's a little bit busy, and I hope this isn't too small, but and I'll send this to you all, but I really like this poster that just came through. Somebody from UW sent it to me, and it says, "Everything is awful and I'm not okay. Questions to ask before giving up." And there's a lot of just basic things that as human beings we don't do. And we make these problems that are going on very complicated because we're really smart and we're problem solvers. And it's actually, sometimes it can seem all about this one big thing. And if you can just slow down and check in. And so these are some great questions. Are you hydrated? Have you eaten in the past 3 hours? Have you stretched your legs in the past day? Have you said something nice to someone in the past day? Have you moved your body to music in the past day? Have you cuddled a living being in the past couple days? Have you seen a therapist lately? Have you changed any medications in the past couple of weeks, including skipped doses or changed in prescription brand? If daytime, are you dressed? Certainly early on in coronavirus, I felt like it was hard certainly to get me out of my pajama pants. I'm wearing dress shorts now, in case you're wondering. But and then nighttime, are you sleepy and fatigued but resisting going to sleep and just staying up late binging TV? Are you feeling ineffective? And that's a good way to respond to that, is pausing. And are you feeling unattractive? Do you feel paralyzed by indecision? And have you just been overexerting yourself? And so these are all things just to be checking in, and at some really basic, like when I meet with people that are experiencing some depression, especially mild to moderate depression, I always start with what we call behavioral activation. So, have you been getting any exercise? How's your relationships? Are you engaged with other people? Are there any hobbies that you're engaged with? How's your sleep and how's your diet? And for most humans, I would say, that are not experiencing serious mental illness, and that's definitely real, if they can get some of those things back in line, they start to feel a lot better, and then can start to move forward. So I would encourage you to just keep that stuff in mind. Sometimes we can make things super complicated, and just remember, like, I'm a human being. the way I sometimes am with my kids, I notice they're freaking out. We always are checking in, or like, well, have they eaten? Have they slept? Like, there's just a checklist of things we do with our kids that we do not do with ourselves. So I would just encourage you to just respect your own humanity, and that you're an animal that needs attention as well. But when there maybe is something more going on, maybe there is a depression or anxiety that's more unrelenting. These are things that certainly are real, and we have really great treatments for, but sometimes can be hard to find treatment for. There's a lot of stigma about asking for help, but I just wanted to, if it does come up with your staff, and I know it can be hard to even bring up, so it may be even just good to bring up in a general setting of just like, hey, today we're going to talk about the behavioral health benefits that we have available if you happen to have health insurance, or if you have access to an EAP, an employee assistance program. Just walking through that right there brings down the stigma. If you're comfortable even sharing, like, I used the EAP once for something and it was helpful. I mean, that helps a lot. Primary care also, we've got mental health resources in a lot of our primary care clinics. That's what I did for the first couple of years in my time at Swedish. I was like the in-house counselor. So if someone was having an issue, the doctors would page me and I'd come right in the room, and then I could have follow-up appointments with them and refer them out. So so there's a lot happening in mental health that if people have a primary care doctor, I always encourage them to start there. Sometimes they don't have integrated mental health and they may seek to refer them out, but actually primary care doctors treat. I was amazed when I started working with them how much depression and anxiety especially they treat in their offices pretty effectively. And then also here we have this crisis connections line people can call. The number's here. And 211, actually anywhere in the country, will get you connected to local resources, and also 211.org is a website that will connect to some local resources. And if there's immediate danger, again, there's concern that someone's going to hurt themselves or someone else, going to the emergency department. Sometimes people are going to be ambivalent about it. Sometimes they're going to go for a few hours. They're going to talk to a social worker and they're going to be sent home with a crisis plan, and they're gonna, maybe the next time they see you, complain about it. And as a social worker, I've sent a lot of people to the hospital, and they're at first, sometimes I'd take it a little personally, and then somebody reframed it for me. They're alive, complaining to you about it, and just yesterday they had a plan to hurt themselves, and maybe they downplayed it, or they got over it, or that was a big wake up call for them, and it was a little upsetting. But at the end of the day, they're alive, and I just encourage you to consider that perspective. If you're that concerned that you're having that conversation, let us, the professionals, make the decision about what needs to happen with them. And we've got great social workers in our hospitals, and we've got actually our telehealth team beams in psychiatrists all over the West Coast. So we've got a lot of expertise at evaluating these issues, and we'll work to keep them safe and make a plan for the long term. So as far as mental wellness, I also want to highlight that it's not all just on sending someone to a therapist. Sometimes people kind of get this message, oh, you have a lot of problems, you need to go to a therapist, that's over there. I think so many of people's issues, if they're able to do the things I talked about and be more engaged in their community, that's going to make a huge difference. I mean, I think we're all responsible for the mental wellness of the members of our community. And listening to someone doesn't mean you're being their therapist. It just means you're being their friend or their colleague or a supportive supervisor. And sometimes that's listening to something personal going on, and you need to kind of figure out what your boundaries are around that. But I think it's certainly appropriate. And again, 60% of those people struggling with mental health will not seek professional help. And so I think being able to have a non-judgmental conversation with someone who says, hey, I understand this is real, I want to help you, there are some resources available, let's look into what there is and get you some help, rather than just saying, I can't deal with that, I don't even know, because that's often what people do, or they just expect that that's going to be the conversation, so they don't even bring it up. And if you want to look at additional resources, the NAMI is the National Alliance for Mental Illness. I talked about Crisis Connections, and then also mental health first aid is something that somebody on my team teaches, that if you all were ever interested in doing that, maybe we could talk about that for a bigger group. But that's like an 8-hour class that's structured and people get certified. It's like a first aid and CPR training for how to talk with people about mental health. It really expands on what I talked about today. So I feel like I talked pretty fast and talked about a lot, and I'm gonna just stop sharing so I can see you all a little bit better, and hoping to just have a little bit of a discussion or answer any questions people have. First of all, I would just say, has this come up in people's workplaces where employees are struggling with mental health issues? Seeing some nods. Okay. Where are people referring their team members to?
Laura?
Well, first of all, thank you. I would love to see a copy of that presentation, because there's a couple things in there I'd love to share. We refer our employees to the Employee Assistance Program, or EAP. But I'm literally, while this is going on, I'm getting texted by one of my employees who spent the night in the ER for a panic attack. So just because
Wow.
the ER has imploded on them. So I would love to get your presentation with a couple of those little suggestions, especially that one chart of, are you hydrated? Are you this? I like that a lot.
Yeah.
But anyway,
Yes, I took a
to
picture
answer
of
your
that.
question, the EAP is where we send our folks.
Which EAP do y'all use?
It's through Association of Washington City, so I can't remember off the top of my head.
Okay.
And so some of our businesses here are like smaller mom and pop shops that maybe don't have very many employees, and it's mostly themselves or one or two others, and so it's, I don't know if anybody else has that, where, we're just as the business owner or the, person in charge, there's a lot of stress that way too. And with how we're handling and we're trying to be all happy and yay, and, I have a question, and it's relevant, but it's more personal stuff. Like, for me personally, like, how do we handle, like, do you have any tips or thoughts of, there's such uncertainty, right? We don't know how long we're going to be in this situation. We don't know how long businesses are going to be shut down, and not having a date. Like, if somebody told me June 15th of 2021 is the day that we'll go back to normal, I'll be like, dude, I can do this. That's no problem. I'll put a countdown calendar, whatever. But the fact that there isn't a date like that, and there won't be a date, obviously, like that. Any tips, like, you just get through the hour, the day, the week? I think it's pretty tough.
Yeah. So I would say the first thing is, I think this idea of things going back to normal is sort of a fallacy. And when were things really normal? I mean, if you look back at the history of humanity, it's always been, one tragedy after another, and also any number of silver linings. And but there is a certain level of normal that, like kids being in school and being able to go outside, that I would hope we can get back to. And but I think there's a lot to be said for just making sure that you're taking on some activities that are promoting resilience within yourself. And there's this concept of psychological flexibility that I really like, that comes from the mindfulness-based cognitive behavioral therapy tradition, which is really around getting present. It doesn't necessarily mean that you need to meditate every day, but yeah, today we got to take it one day at a time, I think, always. And taking the time to be grateful for what is working today, and also noticing when your mind is just like, maybe things are actually okay in this moment, and yet our minds are telling all these stories about this isn't working and that isn't working and all these problems to be solved, and maybe there are actually some things in front of us that need to be addressed, but often that can be a huge distraction. So I think anything that you can do to get grounded, taking some time to even just get in touch with your breath and your five senses. So what you can see, what you can hear, what you can feel, and just go through that, and just be in this moment. And again, usually right now is fine. It's the worry about the rest of it. And your media diet is really important. I was talking to a patient about this yesterday who just had to turn off the alerts on his phone and his watch because he's just getting pinged all day. And I think it's important to know what's going on. And now we're in an election season and all that, but I think it's really hard to miss it. And certainly checking all day, once upon a time, people just read the paper in the morning or at night. And so if you can, if all that is just adding fuel to the fire of your anxiety, kind of keeping that in check, and inviting other voices in. And so if there's people in your life that you'd like to be more connected to, that maybe are grounding for you, making sure to take the time to do that, because there's going to be a new normal. I don't know if it's going to be normal back to how it was. That's for sure. And there's going to be like robots and flying cars soon. So,
I have a comment, but I want to make sure there's not a bunch of feedback. Do I sound okay?
You're fine. Yeah.
Okay. Hi, I'm Becky. Sorry, you can't see me. My camera's not working, but this has been wonderful. Thank you so much. It's just a really good reminder because I'm dealing with this in the workplace right now, personally and with my employees. And it's, we're so busy, we can't get our head above water. And then we have employees trying to juggle homeschooling and all this other stuff. And just wanted to thank you for that information. It's just a really good reminder to have compassion on each other and to ask a lot more questions and peel back the layers of, what's really happening. And also to just maybe get to know the stages of grief, because I heard a really good presentation on that recently, that we're all going through the stages of grief right now, and it's a real thing. And so it's not just about like adjusting to a new normal, but this is a grieving process.
Yeah.
In life as we knew it for ourselves and our kids. And so when you understand that and understand where people are in that stage, I think it really helps to have more understanding and helps to know how to help them.
Yeah, I'm really glad you brought that up. In the stages of grief, it's a whole range of emotion, from depression to anger to sadness to acceptance, and all of that is okay. Those are normal human emotions, and sometimes these days we get the message that we shouldn't be feeling some of those more intense things and we should numb them out. And there's so many opportunities to do that, from Netflix on the mild end to heroin on the extreme end. And those are all, rampant coping strategies in our society. So, but I think there's a lot to be said for just people authentically grieving and accepting, like, yeah, this is really hard and really miss the way things were. But how do we continue to go on?
Yeah.
And think about my grandparents lived through the Great Depression, and some of the things that maybe we just thought we were exempted from in later generations, that was all in the past. And so, but we come from resilient stock, otherwise we wouldn't be here.
Thank you.
Anyone else? Come on, there's got to be a few more questions, comments. Don't be shy.
Ask the therapist anything.
Yes.
This is your moment.
Yeah, I guess I'll ask a question. This is Sean Stewart. First, Josh, I'll say that purple and gold hat you have in the background looks fantastic, and I'm so glad it's there. Secondly, I'm one of those small mom and pop business owners. It's just me. For me, it's not so unusual. I've been doing this for over a year now, but before that, I was a consultant at Microsoft, primarily working from home. So I'm not unused to working from home by myself, but still, I always had outlets before where I could go to the chamber or go to a Rotary meeting, and so I could get out of the house and meet people and shake people's hands, and that gave me some of that socialization that really I don't get much of anymore. So I guess my question would be, for people and businesses like me, what are some stopgap alternatives that we can turn to try to gain some measure of that socializing that we're so badly missing right now, in which, even myself, even being used to working from home, I can feel this is different. You know, this is different. It doesn't feel the same as it used to, even though I'm used to it.
Yeah.
So I can see in myself, you know, a sense of, I don't know if it's not full on depression or anything, but it's just, you know, it just doesn't feel right.
Yeah. Yeah. Thanks. So I would say, for one, taking whatever opportunities, and maybe this is an opportunity for you to lead that. Like, hey, I used to connect with these certain people, you know, reaching out and being a little more proactive when before it just sort of happened and we took it for granted. I'd go to these places and interact with people. And so getting some of those virtual coffees, you know, on your schedule or virtual meetings like this. I think also, you know, a lot of community groups have gone virtual. I'm a member of Toastmasters, and my group that met every week in the Seattle Metropolitan Building downtown. Now it's virtual. I working in telehealth, I'd kind of wondered how we might try to do a lot of things virtual, and suddenly now that's all happening. And so I think also, like, if you have hobbies, I mean, I think, you know, you need to be always balancing those things in your life and finding ways to connect either virtually or at a distance. I mean, I think the smoke is short-lived. So like, I like to bike a lot. So I get together and bike with my friends, which we can kind of do at a distance, or go hiking. And certainly there's, you know, other people out and about in my neighborhood. Like, before the smoke, I would find I could take a walk, and at least just waving to my neighbors was nice, and just, you know, making that eye contact and saying hello. And even if you're talking from a distance, I was in some of my private practice work, I see some employees from Starbucks, and I was talking to a barista yesterday who was telling me just how much they were enjoying engaging with the customers, and he felt almost like a bartender. The bars are closed, but the Starbucks folks put a lot of, like, intention on, like, the customer service and making people feel welcome, and, you know, giving them opportunity to talk a little bit. And so, you know, even those little routines, if it used to be going to a coffee shop, and now, you know, all you can do is just go buy the coffee and at least have that engagement with the barista, that's at least something. And, you know, again, yeah, acknowledging, and I think you're feeling that you had built all these things in that we need as human beings, all this social interaction, that just happened passively, or maybe with a little bit of active energy. And so I think it's planning on it and setting aside a little time. Like, this is essential. This is an essential part of my business, me figuring out how to be out interacting. And before, it just kind of happened, and now I've got to spend a little more time planning. And I imagine you spend time planning a lot of other things. So planning ahead to get that interaction that you need.
Yeah, that's great. Thank you.
Yeah.
I have another question regarding, you know, people starting to feel like, okay, you know, you've heard the word Zoom fatigue, right? Where people are like tired of being online. And I can only imagine, you know, in the healthcare world, you know, you're doing the virtual, all that kind of stuff. Is there ever, I mean, are people going to, like, go through that and then kind of realize they need to do that and to keep going, you know what I mean, to have those interactions, because you can't go to Rotary anymore at the local community center because you can't meet, but yet you still want those connections. And so there's like that, everybody's just feeling like the excitement, like, it's, what's the word I'm looking for, where people just kind of lack of interest, or nobody really, you know, normally our luncheons, we would have 35, 40 people, right?
Yeah.
And we don't get that anymore online. And so you would think it would be it would be easier for folks to kind of connect. And so, I don't know, is that ever going to go away? Or are we always just going to have to deal? I mean, obviously you don't know the answer to it, but, you know, is it ever going to go away? Or are we just going to have to deal with Zoom fatigue kind of in phases as people move forward in our world?
Well, I would say I'm grateful that we have this technology, but it can't be the whole solution. And I think just this is actually a pretty big group. If you, we're still having a meeting here, and if you're managing to just keep this going, and things will reopen eventually. I have hope. And I mean, I want my kids to go back to school. And I like working from home by myself. And so, so I think just acknowledging that, yeah, we have no idea how much longer this is going to go on, but we're going to utilize what technology we have. And sometimes, like, if you can just have a phone call, that's okay too. Encouraging people to stay active and present. I think there's a lot to be said for seeing people, but I think when we're on screen, we have this hyper sense of like, I'm on screen. I always turn my self view off because it's just super distracting. So just make sure you're framed up and turn yourself off. I would recommend that. But I think we're all used to sitting in front of screens for more of our days, and now this is just takes a little more energy. So and if there is a way to do things at a distance, but still together, you know, I don't know if you just meet up at a park, but keep far apart or things like that. And again, the smoke, it will be short-lived. We know that. The rain, but then the rain will come. So, yeah. But I wish I could certainly pull in one of our infectious disease experts to give you a very long answer on that.
Trust me, I get that at home, Josh.
I bet you
I
do.
get that at home.
I bet you do. So yeah, ask your husband.
Yeah. Anybody else? Oh, yes, Elisa.
Hey, I'm a recreation therapist. That's my background, and so all of this information is great. But one of the things that I've noticed in this Corona crap is that people need 3-dimensional people, not just 2-dimensional, and it's huge. And I've we've had staff meltdowns and things like that. And when I talk to them, and they don't realize, they think they're being connected by the screen, and what they don't realize is how much they need to see people in person, and what a different effect that has on their sense of well-being and things like that. And it's one of the reasons why, I mean, the U Symphony, trying to put it together in person, was like, we have actually 5 layers of guidance that we had to wade through to put it together so that we can have a some sort of in-person experience. And it was crazy. But anyways, I just want to encourage people to be creative. I see ladies at Starbucks in the parking lot sitting in the backs of their SUVs having coffee together. There's a lot of different creative ways that you can connect with people, or be outside or whatever, or just don't tell anybody and go to your house and be careful,
Right.
Don't invite the governor. So anyway, just my 2 cents from what I've watched from my staff and all these kids I'm working with.
Yeah. I think I find it fascinating too, is when we haven't been around like people, and we had a little get together with, a small group of people, but you kind of walk away and you're like, why do I just feel so like energized? It was just a weird feeling. And then I realized, oh, I actually was with like people for the first, other than my family, for like, and besides work, I mean, I'm able to come into the office and I see people here, but in the beginning it was very strange. Like, it was a physical feeling that, oh, I feel weird. I feel different. I feel like almost like you have like stuff flowing through, like energy flowing through your body. And I was like, oh, that's why, because I'm actually seeing people. I mean, again, that was a lot earlier on, since I do see people, but you're right, Elisa. I think it's
3-dimensional people are extremely important.
3-dimensional.
I really like the
So that's
3D, 2D thing. I hadn't heard that metaphor before. I'm going to use that.
Is that why, like in stadiums, nobody likes like the cardboard?
Oh my
cutouts?
God, yeah.
You dummy is what they need.
When some neuropsychologists have talked about this concept of limbic resonance, which is sort of what you're describing, this energetic, and when you're with somebody and you really feel connected, and there's ways to even measure those wavelengths in the body, and so it's real, and it's something we need. And I would also say, love the ones you're with. Like, some days I'm on my screen like all day, and then I go upstairs and my wife is looking at her computer and my kids are looking at their tablets. and it's like, all right, we could be with these people, and then we put them all away and we have dinner and roughhouse a little bit, and that is really helpful. So it can be so easy to just notice all the people we can't see, but this is a precious time to bond with the people that we are with, if we're able to really make the most of that. And the way our brains work is there's a lot that we forget, but we often remember things connected to crises or tragic periods, and we remember some details around them. So you're likely to be having a lot of memories that you hold on to from this time. So make some good ones.
Thank you. Anybody else? Okay, well, Josh, thank you so much. I think it was really, really helpful, and I really appreciate your time and kind of the situation, how it all came about. We appreciate you being able to kind of step in and
Yeah,
do
happy
that.
to do it.
And if anybody is interested, I don't know if you have, I think I have your contact. Are you okay if I share anything with that, if this group, if they're interested, if they want
Yeah,
to
sure.
hold you? Okay.
Yeah. And I'll send you these slides so you can.
Okay, that'd be great. Yeah. And we've had this recording, so we'll go ahead and put that out on our website and Facebook page, and have folks able to review it again if they wanted to. So,
okay.
Right. Well, thank you so much,
Nice
everyone.
to see everybody. Take care.
We'll see you again next month, and I don't know, maybe call up that person that and sometimes it'll do the little coffee get-togethers, even if it's just 2 people on Zoom. It's it's sometimes we've had a couple in business after 5 meetings where it's only been like 4 or 5 of us on there. But honestly, those have been kind of some of the, Dawn, you've been on a couple of those. They're almost like better when you have a smaller group of like 4 or 5 people versus like, 20, because you really had, it's like really some great conversations. So just because you're right, just because there's not a ton of people, you can have a great conversation via Zoom with only a few. So
it's the mute phenomenon. When everybody has to be on mute, it's hard. That's one thing when I give presentations in person, you may have noticed I like to crack jokes. I miss the laughter.
Yeah. The muted laughter. That's how you would be very animated, like we're laughing, even though we're not on. All right. Have a great weekend, everybody, and we'll see you soon. Thanks again, Josh.
Bye.
Bye.
Thank you.